I'd like to introduce Joe Hallams and Gail Burton, who are going to be going through our isolation room training. So take it away. Thank you.
Thank you, JL, and thanks for everybody for joining us today. We're just going to kind of take you down and just try to provide some clarification when it comes to isolation rooms or isolation areas, as it may be more appropriately named in some of our facilities. So again, like JL said, if you have any questions, you can keep them to the end or just go ahead and throw them in the chat, and JL will find an opportune time to interrupt us during our presentation. But again, my name is Joe Hallams. I'm the High Desert ESD's school safety specialist, and we've been working very closely with our team to develop not only these trainings, but our COVID-19 response for all of the ESD. It's important to note that, as we kind of continue this, that we in the ESD visit over 40 different facilities within our region. The vast majority of those are actually controlled by other school districts, whether it be Ben-La-Pine or Redmond, 509J, some of the others. Within those facilities, it's important to note that they are in control of their isolation procedures. So really, these are going to be a little bit more specific to the 4 facilities or so facilities that we can control, specifically like Alice Hatch, Manzanita, Prineville, and some of the others. So if you do have any questions regarding how others are doing it, I can help facilitate those questions if you don't feel like you have somebody you can contact within those specific facilities. So as we go through this training, kind of some of my objectives, I always like to outline, what I'm hoping to accomplish and hoping what you guys will get from this training. So we're going to start off with just a couple reminders, the importance of cleaning and disinfecting, as well as what are some of the high risk and low risk symptoms of that we can see within COVID-19. We're going to hopefully provide some direction on where to find these protocols, who do we send to the isolation room and when. We're going to demonstrate kind of a mock example. We have some local celebrities within our ESD that'll be acting it out. And then we're going to just show you a quick video as well on how to don and doff the specific PPE involved with the isolation rooms. And then we'll just kind of point you in the direction of where to get additional supplies if they're needed. So again, it's important to kind of start off with some just basic definitions. And if you have the opportunity to join us with our cleaning protocols, you've seen these before. I think we've been inundated. Paul just inundated is not the right word. We've been constantly reminded that it's important to mask and socially distance. Paul just communicated that again within during his fireside chat this week. And again, it's always important, so we will reiterate it. But it's important to also remember kind of some of the specific definitions we're talking about when we're dealing with our facilities. Specifically, what the difference is between cleaning and disinfecting. As we go through the example of the isolation procedure, we will talk about how it's important to kind of clean up after yourself, but that the actual disinfecting will take place overnight with our professional cleaning staff that we have contracted to come into the facility. An example kind of the difference between cleaning and disinfecting is, as I have on the bottom, if somebody has a bloody nose, cleaning the blood is going to remove a lot of those, the bacteria and other elements within the blood, but it's not necessarily going to disinfect the area. So it's important to kind of do both. And you will see these signs. They are both posted within our facilities and they are within our communications guide that we'll be referring to as we kind of progress through this training. These specifically, it's on the left side of your screen. This is our quick reference guide. These are located in all our facilities, excuse me, and we usually have several copies within our facilities. If you do not or cannot locate one, please let me know. We can have additional copies sent out. And this information is also contained within the communications guide, which is accessed on the dot. And then I'm going to go ahead and at this point turn it over to Gail. She's our school nurse. I'll let her introduce herself, and then she can kind of talk about the right side of the screen and a little bit more detail why we're here today. Gail?
Hi, everybody. Yeah, I'm Gail. I'm the consulting nurse for the ESD. And so we were just going to talk about what to do if a student presents with an illness at school. Let's say they have, you notice that a child, they've passed through the screening initially at the door, but they start looking a little puny, and maybe they have a runny nose and some congestion. So you would decide that they perhaps need to go to the isolation room. So you would follow these steps, and the teacher would call the front office, or one of the EAs could call the front office, and an adult would accompany the child to the isolation area. And then they would don PPE, and so then you would put the child in the isolation room, and we'll go through that whole scenario in the video that follows. And then the lower part is if you believe they need to be tested, obviously you would connect with the parent. As soon as you take the child down to the office, the isolation area, someone would be calling the parent to come and pick them up. And then the rest would be, you would follow these guidelines to talk to the parent about testing or not testing, depending on the child's symptoms and how they're presenting. And then we have we went through these previously. The high risk symptoms would be a cough, difficulty breathing, loss of taste or smell, fever of 100.4 or higher. There is a thermometer in all the isolation bins, as well as an oxygen saturation monitor. The low risk symptoms would be congestion, runny nose, as I just mentioned, nausea, vomiting, stomach ache, diarrhea, sore throat, headache, muscle ache, fatigue. And then we have the low risk symptoms on the left in the second part of the slide, and what guidelines you can follow if the child only has one low risk symptom, or if they have two or more low risk symptoms or a high risk symptom, then you follow those guidelines. And I have been getting some calls from staff, which has been great, just to run through if they notice a child at school that, maybe has a runny nose or some congestion, or, a symptom, some low risk symptoms, just kind of what to do. And what I've been telling staff is that it's kind of like bloodborne pathogens, that, in terms of blood, you have to assume, or any fluid from a body, you have to assume that it has bloodborne pathogens in it. So I think we need to do the same with anything that looks like COVID, could be COVID. So we need to follow those kind of guidelines and not try to second guess, well, it might be allergies or it might be just cold. I think it's important during this time of that we still have quite a few cases that we're following the guidelines that have been most successful in other schools and districts with keeping everybody healthy. Back to
Thanks,
you,
Gail.
Joe.
Yeah, thank you, Gail. Me personally, I always like to look at scenarios or run through scenarios to ensure that I kind of best understand, how to actually apply the protocols or the process that I'm trying to implement. It's important to note that while I'm going to show you an example that we kind of filmed here at Manzanita, that this is going to be unique to Manzanita, and each individual facility is going to have some unique features. For example, up in Madras at the West Building, they don't have a specific room that they can utilize. So we're having to designate a specific area and utilize some other means to try to isolate that individual as much as possible. So it's going to have to be kind of worked within your group. And, each building has a safety team. I'm available. We can always help you walk through if there's any questions on that. So again, it's just important to note that this is an example, just to kind of show you how Manzanita has worked through the process. And then kind of, if a child is to present and you you feel the need to take that child to the isolation room, just kind of what the process will look like. So if technology allows, I will play this video and we'll be back with you in just a few minutes. Like I said, if technology allows.
So for the purpose of this scenario, I'm going to be the teacher and Marie is going to be the student. And she would have come to me in class either saying she doesn't feel well, or I would have noticed symptoms. And I would have called down to the support staff to let them know and ask them to please call the parents. And then at that point, either the support staff or someone in the class that's familiar with the child would go and prepare the isolation room to bring the child in.
So here we have the isolation kit right here that will be in each isolation room. And I'm just going to go through what we have in here. When you open it up and you know you have a child that's going to be coming down, you're going to put on your N95 mask. You're going to put on your face shield. You're going to put on the gowns. Come in something that looks like this. When you open them up, you have to pull them over your head. Just the back part is, instead of having a tie there, it does have a tie right here for the back, for the bottom part. And you have your gloves, you'll put that on. If you think the child is very ill and will want to lie down, the mats are for putting on the floor for them to rest on. And then there's a twin flat sheet that comes in this package, and a pillow that looks like it is inflatable or something. And it has a pillowcase, so that will be for your child to lie down. You can put this over the pillowcase, or if they have diarrhea or one of those type of symptoms, you can put it on the mat as well. There's several in the kit. And then if the child is nauseous and it seems like they might vomit, these are for vomiting. You just open it out and they can vomit into it, and you can tie it off and put it in the trash. And then you have a no-touch thermometer that just goes right up to the forehead, but it doesn't touch. And then you get a reading on the back. And then there's a pulse oximeter in the kit as well. And you put the finger in there and it will make a beep and read. And then you wait for a bit and you'll get oxygen saturation and the pulse. And then we have the paperwork. This is a paper to give to the parents. It's a two-sided that describes next steps and symptoms and so forth. And this is for your documentation of what you did, what kind of signs and symptoms they had, what their temperature was, and what you used out of the isolation kit.
Okay, I would be bringing the student into the isolation room, but the staff would already be prepared with their PPE when I brought her in to the staff. The student isn't feeling well.
Oh, okay. Hi, Marie. How are you today? Please stand right here, please.
So I'm gonna talk to Marie and see how she's feeling, and then take her temperature and see if she does have a fever, and also check with the pulse oximeter what her oxygen saturation is, and then write it down. So this is a thermometer that you don't have to touch the forehead, and it will give you a reading. And press on cylinder, you put it on here. And wait for it to read. You can see on the screen that it's scanning. And it'll come up with a number. You wait till it beeps. It's going up now. So she's well oxygenated. And then you want to document and also see, make sure you've got her in a comfortable position that she can rest in, perhaps offer her to lie down. We have mats in the isolation kits that can be put on the floor to lie down. And then you want to document signs and symptoms that you see and call a parent and keep her comfortable until the parent arrives. Okay, so this is Anna, and she is Marie's mother for today. And so when she comes in, I'm going to describe the symptoms that brought Marie down to the isolation room and what signs and symptoms I found. And then I have a paper that I will give to her that talks about what to do from here, either to take her in and get her tested, and both front and back, there's a lot of great information on low risk, high risk, and positive, negative symptoms, and so forth. So then I will release Brady to her mother, and they will walk out through the front because this room doesn't have an exit here. So then they'll go home and let us know how things work out. Okay, so you've seen basically how the isolation process works, and I just wanted to point out that before you don and after you doff your PPE, that you want to be washing your hands or using this hand sanitizer, which comes in the isolation kit. And I just wanted to point out a few more things that are in the isolation kit. This would go up on the door and remain there until the room is cleaned. And then there are some cleaning supplies in here, extra masks, shields, and some garbage bags. The expectation is that the room would be picked up somewhat and cleaned up, but that the door will be closed and no one will enter until the deep cleaning process is done overnight, and then the sign can come down and it will be ready for the next student.
All right, all kinds of fun. So here's kind of a look at some of those. Well, first of all, on the left side is going to be the isolation room protocols. These again are in that quick reference guidebook that should be out of facilities. So this will kind of actually walk you through that process. On the right side is basically the backside of this sheet, and that's the isolation room log. It's important, you know, in all of this is just like any other tool that we have. It's important to become familiar with this tool. So I highly encourage you to seek out where your isolation room kit is in your facility, open it up, take a look, and get an idea. For example, the isolation room log may not necessarily be in there, that you have to find that guidebook and make some photocopies of that to keep in there. Now, any of the logs that are kept should be retained for no less than a month for various reasons. And those can be kept in a file at the front office or the safety team. We identified COVID managers for each facility. If you need help identifying those people, please let us know and we can help you identify them. Gail, was there anything else you wanted to add to that video? Again, understanding that that was just an example. There are going to be some variables involved.
Just that someone should remain with the child at all times. And also in terms of cleaning up, I think what we discussed was taking the pillowcase off and washing it, but leaving the pillow and the mat, if a child does use those to lie down and rest, leaving those for the electrostatic sprayer that will come in at night for cleaning. And I think that was it.
Yeah, and that's important to note that the room is basically a one-time use per day. So we're kind of hoping that there is not going to be additional needs. Now there are at least 2 of each item, other than like the mat and the pillow, of most of the items within the isolation kits. So it's important to, just like anything else, identify a primary and a secondary. So if that room is utilized, maybe try to think about ahead if for some reason you are to have 2 children within the same facility present in the same day, where would be a secondary place that you could utilize? Because once that facility is used, or that area or that room is used, then it shouldn't be used again until we have that professional staff come in at night using electrostatic sprayers or other sanitizing products that they utilize to sanitize the room. Again, just like anything else, if you need help identifying maybe secondary areas, please let us know. So as you saw, Gail, she was in full PPE, which made it a little difficult for us to understand her within the video, and I'm sorry for that. But we do have PPE guidelines, and at the very bottom of those PPE guidelines are monitoring with someone with symptoms and in isolation. And you can kind of see there at the bottom that pretty much all PPE is required. All of this PPE is provided within the kit, and once it's utilized, I strongly encourage you to reach out, and we'll kind of get to that in a second about how to get additional products to restock your supplies. It's important to note that this is different than the usual PPE or personal protective equipment that we utilize mostly on most of our day-to-day basis. We're all used to wearing masks and occasionally wear gloves. Some people may be unfamiliar with how to don or put on all the PPE that Gail was wearing, because there is a process, and it's important to follow these steps to ensure that especially while you're taking those products off, that you don't accidentally expose yourself to something you're trying to protect yourself. So if you bear with me, this video is about 7 minutes long, but I think it very well demonstrates the process of both putting on this PPE and taking it off to ensure that you're not exposing yourself unnecessarily.
Donning and doffing personal protective equipment. Putting on, or donning, and taking off, or doffing, personal protective equipment is an essential part of being able to safely care for highly infectious patients. In this video, we will demonstrate techniques for how to properly don and doff PPE, which are based on recommendations from the Center for Disease Control and Prevention. But you should make sure to adhere to your own institution's specific guidelines. Donning PPE. You should don personal protective equipment at a safe distance away from the patient. This will be outside of the patient's room in most cases. First, make sure your hair is pulled back away from your face. Next, perform hand hygiene with either an alcohol-based hand sanitizer or soap and water. If using an alcohol-based hand sanitizer, remember to allow the sanitizer to dry completely before moving on to the next step. Then put on your gown, making sure that the gown fully covers your body when closed or tied and does not slip down off your shoulder. There are many types of gowns available. The gown should wrap all the way around your body, cover your torso from neck to knees, and fully cover your arms all the way down to your wrists. Next, put on the respirator mask. Hold the respirator in one hand and bring to your face. Pull the lower elastic band over your head and below your ears. Pull the upper elastic band over your head and above your ears. Press the nose clip to ensure a tight seal of the respirator to your face. Make sure you do not feel any leaks around the respirator. Remember to avoid touching your face. Next, put on your eye protection. You can use either a face shield or goggles. Then perform hand hygiene. Finally, put on your gloves, making sure that the gloves go up and over the cuff of the gown. If possible, have a colleague check to make sure you have followed appropriate donning procedures. You are now ready to enter the patient's room. Doffing PPE. Doffing PPE is the time that you are at highest risk for contamination. Make sure you are slow and careful during all of these steps. If possible, have a colleague check to make sure you follow appropriate doffing procedures. Remember, your gloves, face shield, and the front and sleeves of the gown are contaminated, so wash your hands immediately at any time if you touch or may have touched any of these surfaces with your bare hands. And make sure the waste receptacle is open before you begin. You will begin by doffing all personal protective equipment except for your respirator in the patient's room. There are several ways to remove PPE. We will now walk through 2 ways to remove PPE safely. If you are using reusable gowns that tie in the back or that wrap around the front of the body, you should use this first method. You can also use this method with single-use paper gowns as well. Start by taking off your gloves. Grasp the gloves in the palm of your hand and slowly pull the glove off. Discard the glove in a waste container. Slowly and gently slide a finger under the other glove, between the glove and the cuff of the gown, and slide the glove off. Do not touch the contaminated cuff or outside of the glove. Discard the glove in a waste container. Perform hand hygiene. Remove your eye protection. Avoid touching the front of the eye protection. If using a face shield, tilt your head forward, grasp the strap, and gently pull the strap over your head, pulling the face shield away from your face. If using goggles, tilt your head forward and grasp the earpieces above the ears and pull the goggles away from your face. Discard the face shield or goggles in a waste or reprocessing container. Perform hand hygiene. Slowly and deliberately remove your gown. Avoid touching the outside contaminated surface of the gown as well as your face. If you're using a gown that ties in the back, untie the gown, pull the gown down from your head and away from your body, and touch only the inside surface as you pull the gown off. Gently wrap the gown into a ball with the contaminated surface inside of the ball. Discard the gown in a waste or reprocessing container. If you are using a wraparound gown, reach around the back and slide a hand between the outside layer and clean inside layer of the gown. Remove the outer layer from your shoulder. Gently slide shoulders out of the gown. To remove your arms from the sleeves, you may need to slide your finger under the clean cuff of the sleeve. Remember that the cuff was covered by a glove. Then pull the sleeve off gently. Avoid shaking the gown. Repeat on the other side. Gently wrap the gown into a ball with a contaminated surface inside of the ball. Discard the gown in a waste or reprocessing container. Perform hand hygiene. With your respirator still in place, leave the patient's room and enter the anteroom or hallway. Remove your respirator by gently pulling the lower elastic band over your head. Then gently pull the upper elastic band over your head and pull the respirator away from your face. Make sure you don't snap or fling the respirator. Discard the respirator in a waste container. Finally, perform hand hygiene with either an alcohol-based hand sanitizer or soap and water. If you are using a paper gown with ties that can be ripped, you can use the second method where you will remove the gown and gloves together. Start by removing the gown and gloves together. Grasp the front of the gown and slowly pull away, breaking the ties in the back. Pull the gown away from your body and wrap the gown into a bundle with the contaminated surface inside. As you remove your arms from the gown, peel out of your gloves at the same time. Discard the gown and gloves in a waste container. Perform hand hygiene. Remove your eye protection, avoiding touching the front of the eye protection. If using a face shield, tilt your head forward, grasp the strap, and gently pull the strap over your head, pulling the face shield away from your face. If using goggles, tilt your head forward and grasp the earpieces above the ears and pull the goggles away from your face. Discard the face shield or goggles in a waste or reprocessing container. Perform hand hygiene. With your respirator still in place, leave the patient's room and enter the anteroom or the hallway. Remove the respirator by gently pulling the lower elastic band over your head. Then gently pull the upper elastic band over your head and pull the respirator away from your face. Make sure that you don't snap or fling the respirator. Discard the respirator in a waste container. Finally, perform hand hygiene with either an alcohol-based hand sanitizer or soap and water.
So within our isolation room kits, we have, as you saw, Gail, she was actually wearing the type of gown that we have provided. Those are obviously disposable. So it's going to be that last one. And Gail, correct me if I'm wrong, probably much easier, just kind of pull it away and then remove the gloves. Now within our isolation room outline within the quick reference guide, we have included some graphics on how to don and doff PPE. If you'll notice at the top of those, there is a QR code that you can scan, and that'll take you to the CDC's website, which will show you a video if you need to review that process. Any of the materials that you're utilized, we definitely want to restock. So if you do need additional supplies after the use of those materials, please, try these in order. First, contact your supervisor. Your supervisor can get in touch with the building safety team to get additional materials or supplies that you needed. If that's not possible, maybe contact your building safety team COVID manager. And if that's not even possible, then you can reach out directly to either Bob Martin or Jamie. So that is my Gail and I's presentation that we have for you. We'd be happy to answer any questions that you may have at this point. And JL, I will check with you first. Is there anything in the chat that we need to address?
Yeah, we have one question in the chat, and I don't know if we can address that here today, but Elaine is asking about we have one room at Summit High School where I believe we provide speech therapy to our ECSE students. And the question is, she doesn't know where the isolation room is. She understands that it's in the nurse's station, but again, doesn't know where that is in the building. And also the question of if the ESD staff member would need to stay with the ill student or would the nurse just manage that? And is asking for some help in getting these answers, either facilitating that those questions with the Summit staff and I'm guessing her program supervisor.
Yeah, that's a good question. And first, let me, kind of just provide a little bit of insight. Is Ben Lapine has been kind of a leader in the region. We've worked very closely with them. Tammy Pike is their head nurse over there, and she's done, her and Gail work together, and they've done an amazing job in kind of preparing all the facilities, either Ben Lapine or Gail with ours within the ESD, for sure that we have everything in the process in place. I do know that within Ben Lapine School District, the nurses are leading it. However, there's not necessarily always a nurse that's on staff, or I'm sorry, within the facility. In that case, they've identified additional individuals that will be taking care of the isolation room.
Yeah, that sounds great. My question is just the sheer size of the building and where, I just need to know where to go. And then if we do have to stay, I mean, there's only 2 of us at a time up there. So that would take one of us out, and it's a little worrying, but I mean, if I know where I'm going, that's 90% of the game.
Yeah, and I don't know. I've never been into Summit High. I can reach out, or I can kind of maybe start an email.
Yeah, that would be great. Because quite frankly, I haven't really been in the high school. We just go in our room from the outside and rarely go in there. Sometimes
the only reason I don't know, I don't know what kind of therapy you're providing there, or
speech.
Okay, so speech. I think might depend, and Gail, correct me if I'm wrong, it might depend on the student. So sometimes, especially within like our EI programs, our early intervention programs, not necessarily this one, but some of the children may not be comfortable with another individual. So
and that would just depend on their personality.
Exactly. But again, so anybody that's coming in contact with that individual, once they identify that they may have COVID symptoms, if they're going to be a long-time contact, we'll want them to be in specific PPE. So that would not necessarily you. Now in high school, what they're generally doing is they're putting them in a room where they can watch from the outside. Generally, it'll be a handoff procedure. You will basically hand off as long as they have the contact information for the parents or individual that's going to.
Right. So I would be like Amy was, bringing the kid down.
Right, exactly. So Elaine, I'll write down your name. I will connect you with the appropriate school.
Yeah, and then maybe if what did you say the nurse's name was?
Well, Tammy Pike's the head nurse. I don't know who the nurse is responsible.
Yeah, it would just be nice to have her contact information, on hand, and maybe she could reach out to us. And so we feel comfortable and confident in what we're doing.
No problem.
Thank you.
Great question, Elaine. Joe, that's the only concern that we had posted in the chat.
And thank you for the PPE donning and doffing. That was really good. I learned a lot.
Well, we'll give it another minute. If anybody has any questions they want to chime up and go ahead and ask. And we always encourage, some people may have questions that, it's just like what we talk about with our students. We always encourage people to ask those questions because it may answer the same question that somebody else is lingering. So please feel free to ask if necessary.
I'll jump in, not with a question, but just as a reminder for folks that as we provide these trainings in this format, we're also recording them. And when the upload is ready, we put them on the DOT, which is our intranet, formerly known as the Work at Home site. So if you have a colleague who you tell about joining this training who wasn't able to, know that you can refer them to the DOT to find the recording. Probably we'll post it after spring break. So look for those, and there are a few others there as well.
Yeah, and I was just going to say, I would encourage you, Elaine, to just maybe stop by the office and, and check in with one of the secretaries there and find out, where would you be bringing the child, just so you have an idea, where the isolation room is located, and and if the nurse isn't there, who is responsible for.
Yeah, the issue at Summit is that the office is on the opposite side of the building from where our little classroom is, and pretty much it's not easy to get in there. There's usually, it's Grand Central Station. Sometimes there's someone there, sometimes there isn't. And I mean, I'm up there minimal time, so I need to be with the kids. So
Right.
if we could get it taken care of outside of the actual time that we're there, that would probably be easier.
Right. So maybe you would want to have someone who's responsible would come to your classroom instead
That would be
of.
awesome. That would be ideal. Yeah, that would be wonderful.
Yeah.
Well, Joe's going to start the email chain with you, Elaine, and the appropriate people at Summit. And if you don't feel like you have satisfactory answers from that, please reach back out to us and we'll continue to facilitate or problem solve the issue.
Okay, I will. And yeah, they were, with the reach out from somebody when we went through all the lockdowns and the shooting scares and all that, it was kind of the same situation where we had to do what they wanted, but we didn't know what it was. And then they did eventually have someone come down to our room and go over everything with us. And that was super helpful. And the other thing is we're different people there every day. I'm only there one day a week, but I'm happy to share that information with the rest of the team as well, which is kind of why I came here, because no one else could. So thank you very much.
Yeah, well, thank you, Elaine. And like I said, we'll follow up. And then if you're don't feel like the information is clear enough or you need more, please reach out and we'll continue that work.
Okay, thanks a lot. I appreciate it.
Yeah. So I didn't hear any other questions. I didn't see anything else in the chat. So I think we're ready to wrap this up today. And really thank you.
I'm just curious, one more question.
Oh, sure.
Where is the isolation space at Alice Hatch? I don't work there, but I go there. So it would just be good to know where it's at. Do you know? maybe I need to ask them. I'll ask them.
Yeah, if you talk to, I think Kathleen at the front office, she's
Okay, I'll ask her.
manager of that facility. So
I don't want
she-
to go wandering into it by mistake.
right. No, and there should be a sign up as well. If
Okay,
So a lot of these rooms, that's a good question. A lot of these rooms are repurposed. So once they become isolation rooms, they can no longer be used for the other purpose that they're generally used for. Again, just because limited space, right? So there should be some type of notification on it. But yeah, anytime you go into a facility, it's always best, like I recommended, to try to become familiar with that facility.
and I guess that, I'm sorry, I'm thinking of these questions
Okay,
now
that's
as
great.
these guidelines for the isolation spaces, are they from, and I know you probably told us, is it, because I go in the community as well in Head Start and private programs. And I'm assuming they're supposed to have this as well. I definitely have seen some sick kids out there. I just stayed away from them. But or is this just an optional, this is just going above and beyond being extra safe? Like you said, Ben Lepine's, leading the.
Yeah, no, so it's, the identification of an isolation room is contained within our Ready School Safe Learners guidance. And that guidance came from Oregon Department of Education and the Oregon Health Authority. So it's vague. They state basically we need to identify isolation rooms. So we worked as kind of a region. Most of the work that we've done has been kind of a regional approach to try to be as consistent as we can, understanding especially us in the ESD have multiple facilities to go into. But again, these are going to be specific to educational facilities, whether it be our facilities or K through 12 schools.
Yeah, so they like Head Start, they would be under early learning division, different guidelines.
Yeah, but those are all going to fall if they're high desert or any other educational facility or fall within that umbrella. They are all going to have to be follow those Ready School Safe Learners guidance.
But
Yeah,
you-
you're right, Elaine, Head Start does follow, they are not covered under the Ready Schools Safe Learners.
Right.
Are the early learning division, but they also have a very robust system of protocols and requirements. And that was the kind of the challenge we had with EIECSE is we had two guidances that we had to take a look at, the early learning division and the Ready Schools Safe Learners, and really make sure that we're meeting all of those requirements. So what I could tell you about that is I don't know how our Head Starts are set up, but do know that they have guidance that they need to follow and be in compliance with.
I think that's it, JL.
You got another, you still got some time for another question. Okay, I think with that, we'll conclude our session today. And again, Elaine, just one reminder, if the information you give still doesn't make sense, please reach out and let us help you. Okay, thank you.